Hello, I'm Karen. I'm here at the First Generation Consultancy, and today I'd like to talk a little bit about the Occupational English Test Speaking. So it's very important that you understand the criteria which you are trying to achieve. The test has both linguistic criteria and then it has clinical communication criteria. So it has two sets of criteria. The linguistic criteria are just that. They are testing you on your language. So intelligibility, the main thing to look for in here is that your accent should have no impact on how you are understood. So that's not usually a big problem for Nepalese speakers, but if there are a few points where you can improve your pronunciation, I can help you with that. Fluency. Fluency is the ability to speak smoothly and clearly, and you should not be stopping wondering, okay, what is the word for this? You shouldn't be stopping thinking, what should I say next? How can I get the patient talking? That you should be able to do. So it should roll smoothly. It shouldn't stop anywhere. The appropriateness of language is talking about the correct level of politeness for the speaker. So it's going for the listener in this case. It's going to depend partly on the age of your patient. It's going to depend on emotionally how they are feeling at the time. So you're going to speak accordingly. You might speak more softly and kindly to someone who's very upset about something. You might speak more strictly to someone to a young person who has been careless about something. So you'll speak accordingly. This one is very important. So one misunderstanding about the speaking test is that students would like to just be able to take the speaking test and read what is on the card and explain that to the patient directly. But that will not fulfill this. So you have technical matters. So there are technical words which are used on the task, and you will need to change those into non-technical words. Resources of grammar and expression. You need to be able to explain in the correct tense, and the main thing is that your patient is able to understand you. A few grammar mistakes won't be important unless they confuse the patient. So that is the main thing. And then it says confident in the use of idiomatic speech. Idiomatic speech is like to turn this off, to cut back on coffee. So these things, like we don't say in speaking, we don't say please reduce your intake of coffee. That's not typical. Idiomatic would be you need to cut back on coffee. So there are very simple idioms which are important, especially, taking food. That's not very common to say you should take this type of food. No, you should eat this type of food. So there are just a few things like that native speakers may misunderstand if you use the wrong idiom, but it is not expecting you to use idioms like you can kill two birds with one stone. It's not that type of idiom. Then we go into the clinical communication criteria. These are probably the most challenging because in Nepal, mostly your work environment doesn't offer you a place to practice this type of communication. So you are far too busy, plus it's not really cultural, it's not really the cultural norm to speak in this way. But there are, there are 5 different criteria, and the maximum mark for each one will be 3. So that's 3 times 5 is 15 marks. So it's a big chunk of your test, even though the linguistic criteria are far more. This is still very important. Relationship building. So how do you greet the patient? You should, when you get a speaking task, you should think carefully about how should I start my communication in this situation. So the situations vary a lot. You might be in a hospital ward, you might be doing a home visit, or maybe a patient has come into the community health center. It will really depend on the place, and it will depend on if someone comes into the community health center and there's something serious going on, you're not going to start with saying, "Hello, my name is Karen, I'm one of the nurses on duty here today. How may I help you?" Or you won't start that way, because you will say, "Oh, it looks like someone has cut their hand. Please tell me what happened. Let me have a look at it." And you will go that way. So the speaking task is also, there is no, like the writing, there is no format that this is the order in which you do it. You will find one trick is there will be a variety number of bullet points on your task. Those bullet points, maybe the bullet point number 1 is repeating the bullet point number 4. Maybe bullet point number 3 goes with bullet point number 5. You should be able to understand overall, why am I having this conversation with the patient? What do I want to tell them? What do I want to achieve? So it's very important that you know what the setting is, to know how to start the conversation. This thing, empathy. Empathy is the ability to relate to another person's problem without experiencing it yourself. So in order to relate to another person's problem, you need to listen. Listening is one of the big aspects of the speaking task. So you need to listen and understand, what is their problem? Don't be afraid to ask more about it. Can you tell me more about that? So understand their feelings, their predicament, their emotional state. Usually at the beginning of the task, there will be a negative emotion. Maybe they are anxious, maybe they are upset about something. By the end of the task, that feeling should have reduced, and they should be feeling less anxious, and they should be feeling more positive. Indicators of understanding and incorporating the patient's perspective. Perspective means, how do you see things? Maybe the patient doesn't agree to take the medication. Maybe they have had a relative who took the medication and had a bad reaction. But understand their perspective. How do they feel, and why do they feel the way they feel? So understand that clearly first. Then relate your explanation to how they feel and why they feel the way they feel. So first of all, it's understanding. And second, then explaining according to what they want to know. Providing structure. There are two aspects of structure. One is, if you're explaining how to do something, you can explain step by step. But there will also be a structure in the task. Maybe you need to convince someone, first of all, to take the medication. Then after they have agreed to take the medication, then you can explain how to take the medication. But you must complete step 1 before you go into step 2. So your task should be logically organized so that after the patient has agreed to this, then you will go on to the next point. There will always be 2 or 3 points in the task that you can organize. Indicators for information gathering. This is usually one of the struggles. This is one of the harder aspects of this. How do you gather information from the patient? So make sure you ask them information in an open way. So if you ask yes/no questions, do you have a headache? No. then you're stuck. Then you have to think of your next question. But if you say, can you explain the reason that you came here today? That requires an explanation, and your patient is going to start talking. Then when they start talking, you can ask them more information about that. You can clarify the information they have given. So these open questions, these are questions like, how do you feel about this? Can you explain? Questions. This will get the patient talking. Then here, clarifying, making sure you understand the patient clearly. So check. So you told me this. Did I understand it correctly? Check if you've understood well. The patient will be happy to correct you if you didn't understand well. Indicators for information giving. So it's very important that you don't think this is a task where I am supposed to impart some of my nursing knowledge to the patient. These are usually not that type of task. So whether you're a doctor, whether you are a nurse, it's not just about imparting the knowledge that you have to the patient. First of all, understand, what does the patient know? What does the patient want to know more about? So if the patient has had diabetes for a number of years, they probably don't want the definition of diabetes. So occupational English, they say that this is not based on your nursing knowledge. However, you should have, the more confident you are about your nursing knowledge, the easier you are going to find it to explain. But remember, it's not just your nursing knowledge that they want to have. It's not that they want to know. It is usually related to their emotional state, something that they feel confused about, something that they want more information on. And that's where you should direct your attention. So make sure you understand what information the patient needs. I haven't covered all of these points, but if you use this criteria, and whenever you look at a new task, if you use this criteria to guide how you would prepare your conversation, this will help you a lot, because there are so many points in here that are good for clinical communication. There are also general professional communication tips that will that can be used in any professional setting. So some final tips at the end of this speaking tutorial. Please do not read off the task. Please do not memorize phrases which you plan to use in every task. Patients would rather you speak originally, authentically, from whatever grammar you have, than to hear some memorized phrases that don't exactly fit their situation. Try to ask open questions which get the patient talking about. You can be talking to each other about 50-50. If you are talking 80% of the time and the patient is only talking 20% of the time, something is wrong.